Welcome to the future of fighting cancer. Dr. Matthew Whittick is medical director of the Maryland Proton Treatment Center, and he joins us now. How are you?
Good morning. How are you? I'm doing well. Thank you for having me.
Good. I'm glad you're here. Tell us a little bit more about the Maryland Proton Treatment Center.
Sure. The Maryland Proton Treatment Center was the first proton center in Maryland. Since 2016, we've treated about 3,000 patients, which makes us the most experienced proton center in the Baltimore, DC area. We're very fortunate to have expert radiation oncologists from the University of Maryland School of Medicine that staffs the Proton Center.
And tell us what exactly proton therapy is for us lay people.
Sure. So there are two types of radiation. There's photon and proton radiation, and they're both very good for patients. Most patients are familiar with photon therapy. However, proton therapy is slightly different. In photon therapy, the radiation goes in and out of the patient and treats the tumor. Proton therapy is very precise. When we deliver the radiation, it goes into the patient, but then it stops at the tumor. Thereby, it reduces the amount of normal tissue that gets radiation during the treatment course. But the biggest difference is when we treat a patient with radiation, the normal tissue surrounding the tumor is what causes the short and long-term side effects. For example, if I had a tonsil cancer, my taste buds are right next to my tonsil. So with photon therapy, your tongue gets a lot more radiation, so you lose your taste buds, and you may lose more weight and may need a feeding tube to get through the treatment. Very common. However, with proton therapy, by able to stop the radiation at the tumor, we spare the oral cavity a significant amount of radiation. Thereby, the loss of taste is not very common. Things like a feeding tube aren't very common. Another very good example is, for example, breast cancer. If you have a left-sided breast cancer and you get regular radiation, your heart does get some radiation. Now, if we hope that you live and you live a very long life, that radiation can cause long-term cardiovascular side effects in some patients. So proton therapy stops at the chest wall, and it really reduces the dose to the heart, thereby minimizing the risk of cardiovascular problems down the road.
And then I'm wondering if someone has a reoccurrence of cancer, is proton therapy still an option for them, or maybe not in that case?
That's a great question. In fact, about 25% of our patient population receive re-irradiation for their primary tumor. Now, before when I mentioned regular radiation goes in, treats the tumor, and then exits, it does increase the amount of radiation to the nearby structures. So we don't like to give regular radiation to a patient that's already had radiation because we don't want to damage those tissues surrounding the tumor. And before, as I mentioned, with proton therapy, the ones we deliver at Maryland Proton Treatment Center, it delivers the dose to the tumor and it reduces the dose to the normal tissue surrounding the tumor. So we do see this, that there are less side effects in the re-irradiation setting using proton therapies.
And is there one piece of advice that you can offer for maintaining our overall health? Just trying to get in front of things before they become a problem.
I can say one word: COVID.
Yeah.
COVID has disrupted the healthcare industry in many, many, many ways. And cancer care has not escaped the grasp of COVID. So we know there's a lot of literature now showing that patients have not undergone their normal cancer screening. So now we're seeing younger patients presenting with cancer that could have been caught if they had their screening. And we're also seeing more advanced cancer. So my biggest recommendation is to reconnect with your primary care physician, either in person or a Zoom teleconference, and figure out what are your risk factors and what should you be screened for, and then get your screening. If you are diagnosed with cancer, there are great therapies out there, and proton therapy is one of those brand new high-tech therapies that can help patients. If you're diagnosed, contact our center, speak to one of our radiation oncology specialists so we can figure out if proton therapy is right for you. If it's not, we have connections throughout the entire University of Maryland School of Medicine to help you as well.
Okay. And then what website should we go to for more information?
The website is mdproton.com.
Okay. All right.
Or we can call 410-369-5200 to speak to the Maryland Proton Treatment Center.
All right. Dr. Whittick, thank you so much for being with us. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.